Dear colleagues, welcome to this YouTube video with some additional information on our study. My name is Paul Jansing and I am a doctoral student at Saarland University, Homburg in Germany. This study was conducted in a cooperation of the Saarland University, the Heart and Diabetes Center North Rhine-Westphalia, and the Center for Prenatal Medicine in Münster. To our knowledge, we conducted the world's first prospective study on structural ultrasound simulation training in fetal echocardiography. The prenatal diagnosis of congenital heart disease has been proven to lower the morbidity and mortality. However, in Germany, only 12% of all CHD, and even more concerningly, only 41% of severe congenital heart disease are detected prenatally according to the PAN study. Various training programs for sonographers have been proven to be effective in raising the prenatal detection rate for CHD. Our objective was to assess the effectiveness of a structured ultrasound simulation training in fetal echocardiography. In order to assess the effectiveness of structured ultrasound simulation training, we wanted to analyze the learning curves and skill achievements of ultrasound novices while training on a high-end ultrasound simulator with a randomly moving fetus. There were 3 groups in our study. The intervention group consisted of 11 medical students with minimal prior experience in obgyn ultrasound. The first reference group, the physician group, consisted of 10 obgyn residents, attendings and consultants with a median of 750 performed obgyn ultrasound scans. The second reference group, the expert group, consisted of 10 highly skilled fetal echo experts. All of them were certified at least at DEGUM level 2 and they had performed a median of 2,500 fetal echoes and 15,000 obgyn ultrasound scans. The intervention group attended a 90-minute theoretical fetal echo introduction and consequently underwent structured ultrasound simulation training. The training consisted of 2 one-hour individual training sessions on the US mentor per week. Every 2 weeks, the learning progress was analyzed with standardized tests. The students were given a maximum time frame of 30 minutes to obtain all fetal echo standard planes as quickly as possible. All tests were carried out under real-life examination-like conditions with a randomly moving fetus. The time to completion for each standard plane was measured. The 2 control groups underwent the same standardized tests as reference groups. All participants were initially given 30 minutes to familiarize themselves with the simulator. Now, this is the ultrasound simulator that we used in our study. On the left hand of the screen, you can see the simulator's B-mode image. In the upper right corner, you can see a 3-dimensional model of the fetus that also shows which organs of the fetus we are seeing in the B-mode image. And in the lower right corner, you can see a 3D model of the movements that we do with the ultrasound probe on the maternal belly. Now here we can see a video that was recorded during the examination of one participant. As you can see, there are no aids given by the simulator. The 3D models of the fetus and the ultrasound probe were deactivated. The participants only had the B-mode image of the fetus, just like in a real-life examination. If the participants were satisfied with an ultrasound image, they freezed the image with a foot switch. And if they were satisfied with the resulting freezed image, they would save the image with a second click on the foot switch. that was the noise that you just heard. Only the saved images were included in the assessment. Now let's come to the results. Even after only 2 weeks of training, the students managed to obtain 95% of all standard planes correctly. Furthermore, the time needed to obtain the standard planes was quite comparable to the physician group after 2 weeks. After 6 weeks of training, the students were significantly faster than the physician group and no longer significantly slower than the expert group. Here we see a box plot diagram of the aforementioned results. On the x-axis we have the different groups, and on the y-axis we have the duration of time that the participants needed to obtain all standard planes. Within the student group, we can see a steady and consistent decrease in time. They became faster and faster throughout the training period. In comparison to the reference groups, we can also see in the box plots that the students became faster than the physicians and at the end were no longer slower than the expert group. Here we can see a box plot diagram that shows us what time spans were needed by the participants in order to obtain the individual standard planes by group. This diagram shows us the transverse standard planes. What we can observe here, please note that the scale of the y-axis goes up to 100 seconds, is that the time spans were mostly rather short. In most cases, the participants were able to obtain the standard planes within 10, 15 or maybe up to 20 seconds. Here we have the same box plot diagram as before, but for the sagittal and oblique standard planes. What we can observe in this box plot is, if you take into account that the scale of the y-axis goes up to 400 seconds, that the participants needed, at least partially, a lot longer to obtain these sagittal and oblique standard planes. Based on this, we could hypothesize that maybe the sagittal and oblique standard planes are more difficult to obtain than the transverse standard planes. Well, what do these results tell us? We believe that this is conclusive evidence that ultrasound simulation-based ultrasound training is highly effective to learn fetal echocardiography. We saw that a really significant skill achievement can be gained within 12 hours of individual training. Thank you very much for your attention.